actually recording that because I'm gonna put that on my YouTube channel after, if you guys don't have any objection with that.
Oh yeah.
But um, thanks for your time. My name is Dr. Josuke Tanaka. I was originally born and raised in Switzerland. Moved to California to study chiropractic, and I was interested in chiropractic neurology. So I started with the CARIC program right away in Q1. Um, Graduated in 2014. I spent 2 years doing an internship in San Francisco in a clinical neurology office. After 2 years, I opened my own practice in Oakland. I was in a small room, 8 by 8, pretty small. Some of you guys know. And after 2 years, we decided to move to Hawaii, and so I've been here for about 3 months now. So today, I wanted to share a case with you that I've seen who came a couple of months ago. So I try to keep it as simple as possible. I'm gonna go over the case, and then I think the second part, maybe do that for like 25, 30 minutes, and then the second part we can open up for questions, and I can go a little bit deeper into what can be done. Sounds good?
Sounds great.
All right. So let me. Okay. Can you guys see the PowerPoint?
Yeah.
Okay. So patient comes to me. It's a 14-year-old male football athlete with a hip pain. Okay. He initially, so it's interesting because I didn't know exactly. I just talked to the parents on the phone for a couple of minutes. I didn't know what was the case or anything like that. But over the phone, the mom told me that he had hip pain on the front side. Started when he was running about 4 weeks ago. Saw a chiropractor before, a couple of visits, but didn't have any improvement at all. So first, I thought it was simply like a basic, sports case that just come in, and just treat like that, Um, it's interesting to see that not many people know about chiropractic neurology. So at the beginning, at least, most people are gonna come to your office, even though you do chiropractic neurology, they're gonna come to your office thinking that you're a chiropractor and seeing you for like sports injury, which is fine. Okay. Uh, but right away, when the patient come, when the kid come, like right away, I noticed that there was something a little bit wrong with his behavior in general. Okay, I almost thought he was in the spectrum actually, because just the way he was carrying himself and the way he was walking, and he was avoiding eye contact. So like right away, I noticed there was something wrong. So we start talking with the kid and with the parents. Okay, so uh, what's going on? So they just explain me. A little bit like he just hurt himself running. So okay, is it the first time? Yes. Any other health issue? No. No medication, no problem. So, and I was trying to like say, of course you don't want to be like, okay, well, is your son okay, or does he have any? I was trying to see if there was like anything that was going on besides that, So I started asking, okay, well, how is he doing in school, for instance? And like, oh, he's actually an excellent student. He tutor for other students in his classroom, and say, okay, how is he doing socially? And they're like, oh, socially he's doing great, a lot of friends, fun. Okay, and then we go like, okay, well, how's he doing as an athlete? And they're like, well, he's okay. I mean, and that's when they start saying, as we talk, they start saying that he's actually a bit clumsy. Now, after we keep talking, they say that he often gets injured. Like last year, he had a low back pain. The year before, he has a hamstring strain. Often when he runs, and then ask, well, how is he running? Is he running okay? And the dad says, well, actually, when he actually runs a little bit weird. Everybody says that he doesn't actually move. I'm just going to switch the screen. When he runs, bring his right arm back, but not the left one. Okay, so it's like kind of like he runs like that. Okay, and he's a bit clumsy. And he showed me, I said, okay, do you have a video that you can show me? And they showed me a video of him playing football, and like his reflexes were extremely slow. Like he was supposed to block somebody, and basically when he started blocking the person just like run behind him, you know, and was incapable to catch him. So I was saying, well, he doesn't have a lot of reflexes. Um, and then we keep talking, and then he starts saying that the son starts saying that he often feels some tightness on the right side of his body. Uh, so he saw, for that reason, he saw pediatricians, sport doc, and everybody said that nothing was wrong. He was completely okay. And of course, as I asked the parents, well, what do you think? And they're like, well, no, we think that there is something wrong, but nobody seems to understand. Okay, so here we start talking a little bit, and I start to explain them a little bit, and we're gonna go over that after. But you know, like basically, like it's not because there is not like a condition. It's not like he probably doesn't have nothing wrong on an MRI, but developmentally, there is definitely something that needs to be addressed. And I tell them, well, we're gonna do an exam. Probably I'm gonna test a few things that probably other doctors haven't tested, and that's probably why they said that it's fine. But I'm sure we're gonna find some stuff. Um, So right away, the most important thing when you see a patient, they're not gonna say the most important thing. They're not gonna say it. Okay, that's the key. I think the most important thing that you need to understand is that when a patient comes to the office, the exam actually starts as soon as they walk in the door. All right, you want to see how well, you want to see like if they're on time. You want to see how they fill out the paperwork. You want to see how they say hi, how they walk, you know, everything. That's going to give you a huge amount of information already. Okay. In that case, I can only tell like just, well, here the kid has a really poor posture. He was like basically like that. So when you're a teenager, you don't know, like sometimes they can be very shy. So that's why they're like that, you know. In his case, like he was like that, and his eyes were like looking up, of course, because his head was down like that. So that was kind of extreme. It's like even like shy people shouldn't be like that. Okay, enteropelvic tilt. That also tell me that basically his entire back muscle were just not firing. Okay, like if he was just like completely flat and completely like big muscle imbalances. Okay. Then I was trying to move around and see how he moved his head, and he could basically turn his head right very well. But every time I was moving to the left, he couldn't turn his head to the left, you know, and he had to like turn his entire body. Okay. So those are basic information that I got just talking with him and moving him around and ask him random questions that had nothing to do with his injury yet. Okay. We haven't addressed like what's going on. All right. Then arrive the exam, take his vitals, all normal. Sensory, he has decreased pinwheel sensation on the left C5 distribution. Motor test, everything looks normal. Orthos, everything is normal as well. Palpation, tenderness on the right quad tendon, which was expectable because that's that was his main complaint. So he basically had like a strain. Okay. Now the question is like, well, regular doctor would simply just like maybe do some ultrasound on that quad, you know, ART, Graston, and I told the parents, okay, well now me what I want to do is like find out why does he has that strain on that quad, and also more importantly, why that he had in the past on the hamstring as well, and why is his lower back on the right side tight, and how can we fix that? Okay. So then we go into further testing. Okay. So why would you think like 14-year-old boys who present with that kind of disorder, what would be the most important test to do after? Anybody have an idea? Now, so every time I see a kid, so it's still growing up, the thing that I want to check right after is going to be the primitive reflexes. Okay. You guys know about the primitive reflexes? You heard of it? So in his case, primitive reflexes. They were mostly negative. I was actually expecting the spinal galen to be positive, but it was actually negative. The only one that was positive was the asymmetric tonic neck reflex. Do you guys know what it is? So you put the patient on the knees and hands, and we can talk about that after. But basically, when the patient turns the head on one side, one of the arms is gonna buckle up. Okay, so basically, the patient cannot turn the head without having an arm moving around. Okay, and that's something that actually is normal when you are a few months old, but as the brain matures, it's supposed to be suppressed. Okay, it should be suppressed by 1 year old. In his case, it didn't get suppressed. Okay, it was still there. So that explains a lot of things already. Okay, so from there, I checked the cerebral testing. Okay, so we did a Romberg test. He was extremely poor. I'll show you after on. I have a platform that actually checks center gravity, but his balance was extremely poor for a young kid. His finger to nose, having his eyes closed, and I have touched your nose with your index finger. Normally, it's quite easy to reach your nose. He was like past pointing. He was missing it at 1 to 2 inches on both sides, which is also not something normal. GDK, so Digiatokokinesia, I had him like turn the hands like that. He was not very coordinated. Okay, so those are tests that check for the cerebellum that's responsible for proprioception, balance, and that was really not great. Okay, then piano playing, the other test, so you have to like have the patient move like that, the fingers, and that was also like pretty bad. Then I had him do a figure 8 movement. So figure 8, it's actually normally you don't test it. It's more like a therapy exercise because it stimulates the cerebellum. Just patient staying straight and just move like that. The hands, you gotta have heard of that, yeah. So I had him just say, hey, why don't you do that for a little bit? I want to see how you do it, and that's how he did it. He actually moved his body with his arm. He couldn't dissociate his trunk of his arm at all. Okay, so that was another big observation here. Checked his balance. So here, don't need to understand much here, but that's a report, and those circles represent his sway. So the smaller they are, the more stable he is. Okay, you want them to be quite small. On the top, the very top, I had him on a flat surface, on a balance platform, flat, and he had on the left with his eyes open, and on the right with his eyes closed, and he did pretty well. But then at the bottom, I put a foam, okay, like a foam pad, so that make the surface a bit more unstable. And he see right away his balance got worse with the eyes open, and then eyes closed, he actually almost fell, okay, which is quite a bit of a concern. All right. So then after that, I went a little bit deeper and started to check his eye movement. So like I said, his eye movement. So first of all, in a resting position, his head is down like that. So in order to watch me, he has to look up. So he had his eyes up like that all the time. Okay. His pursuits were good. So I had him like follow my thumb, and he was able to like follow my thumb. Even though at the beginning he was moving his head as well. So, okay, no, don't move your head, keep your head straight, and just move your eyes. And for that, he was actually doing quite well. Those are all observations that I did without any machine, just like have him looking like that. And then I have him doing saccade, so quick eye movement. And for that, he had a hard time. So first of all, when I had him like moving my thumb, he was extremely slow to move his eyes. But then every single time he was moving his head as well. You know, he couldn't isolate his eye movement from his neck movement, okay, which is something you should be able to do. And also he was really slow to start them, okay. Optokinetic, they were very poor, especially going up. So I had like simply that tape, you know, you can use an app on cell phone as well. You know, you get spray nose, that kind of thing, right? If you guys see that, so he was doing pretty poor in all direction, but the worst was up, which makes sense because his eyes were already stuck all the way up. So it's hard for him to like follow something that goes up if your eyes are already up. Okay. So that was the major findings. Okay. Now I put him into another test, and that's a machine that I have that tests like more the vision in general. And in that case, are you guys able to read the report here? Not really. So it's a test. You have 7 different tests that test your different visual function. Okay, and it's all based on the percentile. It's compared to other athletes of his age. The biggest circle here is the 100th percentile. So if you're there, that's where you want to be. That line here is the 50th percentile. So that's like the average, and everything below that is pretty poor. Okay. So the first set was visual clarity. He's very good. Not too much to say about that. Contrast sensitivity. He did really good. That depth perception, he was really poor. See, he had a hard time to see like the different depth and see if an object is close or far. Near far quickness, so that's how quick he can focalize his eyes on a near target to a far target, and that was actually also that was borderline, but that was not the greatest. Perception span, that's how he can memorize some visual stimuli, and that was borderline as well. Where he was really struggling with, he only had like a 5%, is multiple object tracking. Okay, and that's actually his capability to see different objects at the same time. And then his reaction time, which was extremely surprising, his reaction time, he actually basically has to have both hands on the screen, and every time a circle become red, he has to lift it up as quick as possible. Okay, and his reaction time for that was actually outstanding. He was really good. So his parents, of course, didn't understand really well. It's like, oh wow, we thought his reaction time was not so good, but it turns out that he was pretty good. So the problem was somewhere else. Okay. Here, so what happened is that so far, based on that exercise, so, I mean, based on those different testing, I told the parents, well, here's the problem. First of all, he has a very poor motor control. Like he cannot dissociate very well his movements. Him to lift his arm up, like the entire body moves up. When I ask him to turn the eyes to the left, the neck to the so I told him like normally we should be able to isolate that, and in his case, it doesn't do a great job. So that is mostly due to the retained primitive reflex that he had. Okay, that was the first point that I told them. The second thing that was important is that, and that's probably linked with that, is that his balance was pretty poor, and that they pretty goes together. I told him, well, he needs to improve his balance because, of course, if he wants to be an athlete with a balance like that, he's not going to go very far. And the third point that I told him, you told me that his main concern was his reflexes. His reflexes are actually really good. He's actually extremely quick. The problem is that based on the test that we did, whether it's like his multiple object tracking or his quick eye movement that was really slow, what I told to the parents is that his main issue is that he has a hard time with peripheral vision. Okay. And he's really good with focal vision. So when he has to focus his eyes on a target that's pretty close to him, he does really well with that. All right. So that's why his reaction time, it's on a small screen. So he was really good with that. That's also why he's a really good student and he had no problem with school. But that's why he has a hard time playing football, because football, you have to have your eyes the field, you have to look at your teammate, you have to look at your opponents, you have to look at the ball and everything. And I told him that's too much stimulus for him. Normally, the brain, one of the most important function of the brain is to attenuate stimulus, okay, whether it's visual, sound, anything, so that you can focus your attention on one thing. And in his case, his brain doesn't do a great job for that. Like for him, it takes a hard time to process different vision, the different visual stimuli that he's gonna see, and by the time he actually sees it, it's too late for him, and hence his reaction time is slow. So I tried to explain them, and they got it. That the problem is not the a muscle twitch type of issue. The problem is that he sees something, and it takes time for his brain to process it and actually to activate it. And I wish I had the video to show you guys how he was playing football, but that's really how he looked like. Like somebody throw the ball and he takes him like he's like almost 1 second behind everybody else before he start to make a move to try to catch his opponent, and by then it's too late. Okay, so hence it takes that much time. He has to do those movements that are so slow. That's why he gets more strain on his muscles. Okay, so I explained that. Well, that's because his reaction time is, I mean, his processing time is so difficult for him. Then he's one step behind. Sorry. Sorry about that. So that's because of that, he has to quickly move, and that's when he compromises his muscle system. All right. So that was the third part I was trying to explain the parents, and they understood. So then what do we do? So treatment plan. The first thing, I wanted to get rid of that primitive reflex, which is the most important in his case. So I gave him a cross crawl exercise. For each primitive reflex that's retained, there's a technique to actually suppress it. Okay, and we can go over that after. Then after that we did some movement retraining. So what I had him to do, for instance, I have a laser that I put him on his head that points towards the wall, and I had him do movement with his right hand while he keeps the cursor of the laser at a fixed point. So really to teach him to like dissociate movement. Okay, and I had him to do that at home. I had him buy a laser at home. Had his dad install it on either on his head, on his trunk, and try to learn to move his different limbs, whether it's the leg, whether it's the arms, left side, right side, moving in every direction while his trunk was staying straight. Okay. And the third part, we trained his peripheral vision. Okay, so that was that involved a little more like using some devices that I have, but you can do also like basic exercise, whether it's like quick eye movements, very basic, guys. Even if the patient have a hard time to do like quick eye movements, then you do quick eye movement to rehab him. Okay, you don't need to understand every pathways in the human brain to get somebody better. As long as you understand what is going on, you can actually get some good amount of improvement by working what's not working. In his case, saccades working well, so guess what? We work on his saccades. Okay, his pursuits were doing good, so we didn't do too much on his pursuits. So after it's been 4 weeks, I've been seeing that kid once a week. And 6 weeks now. So, I checked him last time. I was last Monday, so 3 days ago. His asymmetric tonic neck reflex was fully suppressed. His figure 8 now he can completely isolate like that without moving his trunk anymore. His balance is much better. I haven't rechecked, but we're gonna recheck next visit. His balance is much better, but most important for me is that it's not what it looks like in my office. It's how it looks like in real life. So his parent told him that even after the first visits, actually, he run completely differently, and now he can actually bring his left arm backwards, and he's faster when he runs, much more coordinated. And even his trainer noticed that. He said that um, he does better with that. His balance is better, uh, better reflex, but he still a little bit of difficulty with reaction time. Right, so that's where we're getting so far. And like I was telling to the parents, well, that's good. We got some improvement. You can definitely you should definitely keep going. Okay, but also recommend them. I think based on how he presents, football might not be the best sport for him. Okay, because well, first I told him about head injuries. If he can stop, that would be good. Say, but also because there is so much peripheral vision that's involved in that sport that he would do much better in a sport where you have to focus on just one target. Okay, typically like martial arts. So the dad was like, "Oh, actually, he does wrestling. He loves wrestling." I was like, "Well, he's probably gonna be a much better wrestler that's gonna be a football player." So I think if he like both and if he prefer wrestling, you should definitely focus his energy on that. Even though of course you want to work on the deficits, but and that's something we're gonna keep working on. But I think if he can do better, like doing a sports when he can focus his energy on like on one like focal target, that would be much better. I told him also there's sometimes people who actually does work with the focal vision and do better with peripheral vision. And those are typically the kids that actually don't do that. Sorry, sorry, I didn't think about the phone. Those are kids that don't do well at school because they have to focus their eyes on a book or something like that, and it's extremely difficult for them. Whereas if there are like multiple things coming in every direction, like a football game or something like that, it's actually much easier for them. So I told him in that case, it's actually for him, it's the other way around. He's like better for like with focal vision, and it's actually academically it's actually it's a much better thing. So I think it could be worse, and parents understood that. So yeah, so here is the case. We keep working with him once a week for a few more weeks, and then mostly gonna give him like exercise to do at home, and keep improving his function. All right. So that was the case. Now, do you guys have any questions regarding what we talked about? Yes.
How long did you spend with them? So you said after 3 weeks you saw an improvement. How long did you spend with him per day, and how many times a week? I'm not sure if you mentioned it.
Yeah. So the first visit was a couple of hours with all the testing, and then it was 1 hour a week. Yeah, 1 hour a week. If you try to create plastic changes on the brain, repetition is the key. The more you do, the better it is. And I told the parents like bigger neurological clinic, they do like intensive 1 week, like five visits a week. I mean, sorry, 5 visits a day. That's not really realistic in a small clinic like mine. So that's why I told the parents like, well, he has to do his own home exercise like 5 times a day. If he doesn't, it's gonna take longer time to see changes. Okay, so my goal was really to make them understand the principle of neuroplasticity and how repetition is important. And luckily, those parents were really very receptive and they really were motivated. So it turns out really well, and we saw changes right away. Like right after the first visit, we saw some changes. But if you have like somebody who's not very motivated or just doesn't do much at home, 1 hour a week would never be enough, for sure. Sounds good? Yeah.
So, did you do any like nutritional work or blood lab work with him?
So I did not. I just mentioned them that it was for the so on my intake form. I always give the metabolic form. You guys are familiar with the metabolic form? It's like there's like 15, 16 categories, like gut, adrenals, liver, detox pathways, and all of that. So I give you a good screening. So I always give that to my new patient to see if there is something going on, and then I ask, okay, on the review of system, how is the digestion, what the kid is eating, and everything. And he was pretty healthy. He was pretty healthy. The mom cooks at home every time. They avoid junk food. Um, they avoid sweets and soda drinks and stuff like that. So I didn't push too much for that. I just told him to add some omega-3, so he added some fish oil. DHA is very important for brain development. So I just have him take some fish oil. But for the most part, I didn't do much. I told them, I mentioned them, but they were also on a budget. So I told them, well, if you want, that's something that can be done. If we don't see any changes, that's something that can be done. In his case, because I saw changes right away, I didn't waste too much time on the nutrition aspect. But if I hadn't seen any changes at all, I would have pushed a little more for blood work for sure.
Sounds good. So, do you kind of just conduct the same exam with all your pediatric patients, or was this more unique to his case?
I would say it's about maybe it's fairly similar, to be honest. Fairly similar. Maybe 90% is gonna be the same exam, and then 10% is gonna be based on the patient's condition. If somebody like primitive reflexes, I don't check on any single patient. In his case, I saw right away there was something like developmental going well. I mean, not going well. Sorry. So that was the first thing coming into my mind. You always want to cover the basic stuff. You know, I didn't talk too much about on during the exam, but like the hemisphericity stuff to make sure that there's no like any weakness in one side, any change in sensation in one side or the other. He had a little bit, but it was mostly nothing too consistent. So he didn't have like he didn't have like a hemisphericity type of lesion. So that's why I didn't spend too much time of working right brain versus left brain. But if I had seen somebody that had like more remarkable hemisphericity, for instance, I would have done more like hemisphericity tests to make sure that there is like how much discrepancy there are and how to correct that. All right. Question?
Yeah, two more questions. So
Yeah.
initially in your findings, you said that he had a lot of tightness on the right.
Yeah.
Was that due to the lack of peripheral vision that he would react? Is that what you mentioned? Or because when you're talking about hemisphericity, was that related to that, or it was just kind of a? Can you talk about that symptom?
Yeah, that's a great question. That I'm not sure because it was mostly subjective. He was feeling tighter, and I'm not sure if what he meant by being tighter, but at least when I was doing like range of motion, muscle testings, and things like that, it was pretty symmetrical. Um, in his history, he mentioned that he would always get injured on the right side. Um, so maybe that's the reason why it feels tighter because there's more like maybe tissue damages or something like that. But again, when I was testing for like I was doing like different testing to see like right versus left, it was pretty symmetrical. So hard to say if there was actually like a decreased output on the left brain, and I couldn't see that on the exam very well, or maybe it was just temporary. At that time when I was doing the observation, it was fine, but maybe at other time of the day it started to develop, or it's just more like maybe he started to injure his right side because he is right-handed, or maybe because he play on the right side of the field and he exposed his right side of his body more. Hard to tell.
And then you also said that you might come back to that primitive reflex that he had wrong. Can you go through it with us again on what the test you did exactly? And for that one, you tested, I kind of started writing it down. You have the Minsky Palmer, that one, and there was another one.
Yeah, so there is a great, I really encourage everybody to buy. It's that one, Reflex Learning and Behavior by Sally Goddard.
Sally Goddard.
Goddard, yeah.
You can't see it. It's tiny, tiny on the screen. So.
Yeah, Sally.
Sally
Yep.
got it. Yeah, I think I have it.
So yeah, Reflexes, Learning and Behavior, a window into the child's mind. It's an awesome book because she explains why kids have retains their primitive reflexes, how to test it, and how to correct it. And there are other books as well by the same author or other author that go over those different reflexes. There's a bunch of them. In his case, I didn't check all of them because I was kind of expecting which one would be positive, which one would be negative. So that's based on how the patient presents. So that's why I only check 5 or 6 of them that I knew that if they were positive, it would be a game changer. Sounds good.
Were you checking the eye movements with VNG?
No, I don't have a VNG yet. It's coming next month. For several reasons. First of all, a VNG is very expensive.
Yeah.
And second of all, Caitlin, you're leaving us.
I have to go to the job fair.
Okay, good luck.
Thank you.
Bye. It's very expensive first. And second of all, I wanted to work on my capabilities to diagnose it, to use it using my own eyes without using a machine first, okay? Because the problem is that if you depend only on your on the VNG, I think you miss a little bit of observation skills, and I think that's really important. That's and that's that thing that reminds me a little bit. I don't know. I feel like you should be able to know those skills without depending on the machine first. The machine is going to be great as you get better to diagnose the small details, but you want to be able to see those small details without a machine first. Make sense?
Sounds good.
Just to give you an example, guys, when I graduated, I did an internship at Dr. Azzolino's office in San Francisco that I definitely encourage you guys to check out. It's probably the best clinic in the country, private clinic. We had literally everything, and that was awesome. Hyperbaric chambers, BNG, tech, everything. That was great. But talking with Dr. Azzolino, he started with nothing. He had nothing. Most of the tools he had less than 5 years. So most of those tools don't exist for a long time. And for the functional neurology, it's been around for 30 years. So the first 25 years, clinician had nothing besides the eyes and the hands to observe and to make changes on the patient. It's only recently that we have all those expensive machines. So you don't want to get caught in the idea that you are dependent on those expensive machines. You can do great things without them for sure. When I started to practice, I had my room, when I opened my own office in Oakland, I rented a room that was 8 foot by 8 foot, like 8 by 8, like super small. I really had nothing, and it worked well. Of course, you have maybe less impact. You can see things that you cannot see, but you can get a huge amount of work done and huge improvement in the patient, even with a very small room with almost no equipment.
I have one more question.
Yeah, of course.
Would you suggest to do an internship, like a preceptorship here in the area for functional neurology, like that? I mean, I know Arzelino, and like you said, he's the best. But like you said, if we learn to depend on, I don't know, I'd like to have your input on that, depending on, I would say, toys or gadgets. That's kind of how I call them, you know, to do funk neuro. Like, what's your opinion on that?
So for me, I did my internship 2 years, and for me, it was the perfect time. It was not too long, not too short. Um, it depends on where you at in terms of knowledge, in terms of your experience. There's like good and bad things doing an internship. The good thing is that you're gonna learn a lot. The bad thing is that you don't build your own practice. You don't build your own business. So
So in the program now, I don't know how it was back when you were
yeah,
like a mother. So here, the last 3 months or the last 6 months of
got you.
our thing, we can be in a practice.
Yeah. So you are still in school.
Spend some time with a doc in their practice and learn from them while we're in school.
Yeah.
Yeah.
So you are still in school. You haven't get your degree yet. Yeah. So that's the perfect time to do an internship and see somebody. I never understood why in chiropractic is so little, 3 months. I think it should be a little bit longer. Like med school, nurses, everybody else is like I think a year or stuff like that. And I think that's what's lacking in the profession is like having a longer internship. But yeah, it's a great way to learn not only like your clinical skills, also your like how to run a business, how it works with scheduling patients, how to work with like a front office and all that, because all those things they don't really teach in school. Um, so that's super important. You definitely want to be with somebody that you like. You find like ideally I would encourage everybody to find a mentor. So like start shadowing, visiting offices that a different place that you like, and try to find somebody that's like a mentor that you can follow. And that was a blessing for me. It was I started with at Azolino as a student. I did my preceptorship for 3 months there, and then they liked me, so they hired me there. But that was really good. It was a real blessing for me. So and also because for me,
How far along were you in the program when you did your preceptorship over there? Like
uh,
it's
in the CARIC program,
in the care program.
so I was pretty much done because I started the first quarter to take the CARIC modules. So by the time I was in quarter 12 at school, I was pretty much done with all the modules. The problem is that those modules, they don't, for me at least, didn't help me a lot, because it's kind of like I don't think the instructors are doing a great job to teach some of them. It was really confusing and it was not very applicable. So it made a huge difference to actually see in clinic like how it works, and like even a single week or a single day in that clinic observing was actually I was learning more than like a full module. So for that it was really nice to set another perspective. Have you been taking those modules?
Yeah, we're taking the RB series and I'm doing the SNS modules.
And how's that going for you? Is that a little bit complicated, or does it make sense? Or
They're making it way more digestible
Yeah.
now.
Good. Okay, well, that's awesome. Well, at our time, it was not like that, so it was really difficult. Yeah, it was a bit frustrating, but I'm glad that it works well for you guys.
Yeah, it's working out. Thank you.
Well, thank you. We're about to start class in about 10
Okay.
minutes. I'm going to wrap it up. But thank you so much. That was great. We'll keep in touch about any future talks.
Yeah.
Yeah. I'll still be here for another year and a half. So.
Perfect. Yeah, feel free to give my contact information to the students if they have any questions.
Definitely.
Be happy to help.
Well, yeah, add him on Facebook too.
Yeah.
Cool.
All right.
All right. Thank you. Have a great
You're
day.
welcome. Take care. Bye.
Thank you so much.
Thank you. Bye.
Bye.